Hello and welcome to Pregnancy Info. Today we are going to discuss about menopause, its symptoms and how does it start. You are in menopause when you haven't had a period for 12 straight months and you are not pregnant or sick. It's normal part of aging. It happens because female sex hormone levels naturally go down as you get older. Your ovaries eventually stop releasing eggs, so you will no longer have periods or be able to get pregnant. It most often happens when you are in your 40s or 50s. The average age in the US is 51. It can happen earlier if you have had surgery to remove your uterus or ovaries or are having certain treatments for cancer. Are you transitioning into menopause? You may start to notice changes months or years before you are in menopause. Some of the first signs of the transition are often so-called vasomotor symptoms, such as hot flashes or night sweat. You may also start to notice irregular period. This time of transition into menopause is called premenopause. Menopause symptoms. Now we will discuss all symptoms you can notice in the menopause or when you are going to enter in menopause. Number 1. Irregular periods. Your periods may be considered irregular if the time between your menstrual cycle is longer or shorter. You skip a period or your periods are lighter or heavier than usual. You could even skip a period. This is a classic sign of the transition into menopause. Some chemotherapy drugs used to treat cancer can also make your periods irregular. Any bleeding, even just spotting after menopause isn't normal. You should talk to your doctor if you have concern about an irregular period. Number 2. Vaginal dryness. During menopause, the skin around your vagina may become drier. This can make sex hurt. Gels called personal lubricants can help, and you may feel also itching at this area. Vasomotor symptoms. Hot flashes can make you feel warm or hot suddenly for no apparent reason. Your skin may flush red and your heart may beat faster. Then you may feel suddenly cold. Night sweats are hot flashes that happen during sleep. They may be so intense they wake you up. Like so many symptoms of menopause, hot flashes and night sweats can vary a lot from person to person. They can last 1 minute or 5 minutes. They can be mild or severe. You can have several an hour, one a week, or never have them. Mood swings. Lots of things can affect your mood, and that includes the effect of changes in hormones that happen around menopause. If you have had anxiety or depression in the past, your symptoms may worsen during menopause. If you feel anxious or depressed for more than a few weeks, tell your doctor. Together you and decide on a treatment to help you feel better. Sleep problems. Waking up during the night or having trouble going to sleep can happen for lots of reasons, but if you don't typically have problems sleeping, it may be a sign you are approaching menopause. Sometimes it's caused by vasomotor symptoms like night sweat. If sleep problems hang on for a while and you cannot pinpoint why you have trouble sleeping, it may be time to tell your doctor. Body changes. You may also notice your hair and skin become drier and thinner. You could gain weight during menopause. Your body also might change so that you may have more fat around the waist and more fat and less muscles in general. You may also find it a little harder to move with stiff joints or joints that hurt. It's important to stay active. You may need to work harder to keep your strength and stay in shape. Drop in sexual functions. You might feel less interested in sex or have trouble getting aroused when you are in menopause, or you could enjoy sex more and feel more free because you don't have to worry about things like getting pregnant. Forgetfulness. Anyone can have minor memory lapses during middle ages, such as not being able to think of a word or losing car keys. Usually it's not a big deal. Forgetfulness can occur during menopause but can stem from other factors like stress. If you're worried that you are forgetting too much, let your doctor know. Peeing more often. A lack of control over peeing can be another symptom of this stage of life. Activities like coughing or lifting may cause you to lose pee, or you may have a strong instant need to pee that is followed by a low. You may also get more frequent urinary tract infections. We shall disparities in symptoms. Research has shown Black women have more serious menopause symptoms like hot flashes, sleep problems, and depression than white women, but they are less likely to get hormone therapy or other treatments. They also go through menopause an average of 8 years early. Some studies show Hispanic and Native Hawaiian women may begin menopause at an early age than white women. Early menopause. Early menopause before age 45 is considered early menopause. It is called premature menopause when it happens before age 40. Premature and early menopause symptoms are similar to those of menopause that happens later. Causes and risk factors include a family history of early menopause, starting your period before age 11, etc. Want to go to a doctor. When you choose to see a doctor for menopause symptoms, if they affect your daily life or concern you, like hot flashes that keep you from sleeping, mood changes, or body changes that affect your sex life. Some people don't have symptoms that they feel are serious enough to require medical treatment. They may find ways to deal with their symptoms such as changes in diet, exercise, and relaxation techniques. Now, a question may arise in your mind that can you get pregnant after menopause? It is possible to get pregnant during the transition into menopause or perimenopause. The possibility doesn't go away until you enter menopause. See your doctor about contraception options if you don't want to get pregnant. How long does menopause last? You can have menopause symptoms for as many as 10 years. Most often they last less than 5 years. What are the signs of coming to the end of menopause? Post-menopause is when you haven't had a period in 12 months. Typically, symptoms become milder and may go away after this. You remain in post-menopause for the rest of your life. This puts you at a high risk of heart disease and osteoporosis. Lifestyle changes such as diet and exercise can reduce this risk. So, this is all about the symptoms of menopause. Share this information with the female who are going to enter in this transition state, and also share your opinion. How do you find this video? Thank you.